Sukanya Saha to give a talk on an unconventional approach to treat a case of mechanical ptosis due to large lesion. First one, sir.
Mike. Hello. Good morning, everyone. Here's presenting you on a case series of an unconventional approach of large lesion with mechanical ptosis. A chalazion has been all known as an idiopathic sterile chronic granulomatous inflammation of the meibomian gland. Incidence of chalazion is 0.24%. It's found higher in females. Ptosis is an abnormally low position of the upper eyelid margin determined while the eye is looking in primary gaze. Large chalazion can induce mechanical ptosis. Intralesional steroid injection has been reported to be effective with high success rates. Aims and objectives of our study: primary is complete resolution in size of the chalazion. Secondary objective, correction of the mechanical ptosis, and follow-up for 6 months for any signs and symptoms of steroid toxicity and recurrence. Treatment options available: warm compression, medication, surgery, corticosteroid injection. Surprisingly, 1/3 of the chalazion resolves spontaneously with conservative management with hot compression. Methods used: study design is a single-center prospective, non-randomized interventional study. The population includes all cases encountered in OPD confirmed to have been chalazion without the need for biopsy. Inclusion criteria includes all age groups, both sexes, large primary chalazion with mechanical ptosis, patients not willing for surgery, and chalazion located close to the lacrimal puncta. Exclusion criteria includes history of large surgery or trauma, multiple chalazion, recurrent chalazion. Total sample size taken is 5 patients in which we gave intralesional triamcinolone 0.1 to 0.2 ml. If there was any residual chalazion left, injection was repeated at 2 weeks interval until complete resolution and 6 months follow-up for steroid toxicity or recurrence. Here are the pictures of pre and post intervention of a female patient which needed 3 subsequent doses of injections 2 weeks apart for complete resolution. Here are the pre and post interventional pictures of patients which showed excellent results after only 1 dose of injection triamcinolone. The results were based on the lesion size, including digital color photography, lesion regression or recurrence, and complete ophthalmic examination, including margin reflex distance, palpebral fissure height. The clinical characteristic of the studied patients: mean chalazion size taken was 0.8 mm square. 4 of our patients showed complete resolution, and only 1 patient needed 3 doses 2 weeks apart. Here are the complete ophthalmic investigations of pre and post interventional values of our patients. We can see that only 3 doses are needed in 1 patient, whereas 4 patients resolved after only 1 dose. Here are the statistical values. Now coming to the discussion part, in pavasic acid loss study, we can see that 35 cases required only 1 or 2 injections, and castrain showed excellent results, 88% cases. Pizzarello study, it showed 7 chalazion resolved within 2 weeks with only 1 injection and other 6 after 2 injections. Whereas in our study, only 1 patient needed 3 injections and 4 cases resolved after only 1 injection. Regarding steroid toxicity and recurrence, Pizzarello and Palva and Pojolvento, 2 cases, recurrence was there, and in Palva and Pojolvento, 6 out of 20 cases recurred after 3 to 6 months. But in our study, there was no recurrence as well as no steroid toxicity. Conclusion: intralesional triamcinolone is found to be a safe, convenient, and alternative to chalazion surgery. No recurrence were reported in our study. Caution: hordeolum must be ruled out before triamcinolone injection. For those in recurrent chalazion, sebaceous cell carcinoma should exist, a suspicion, high index suspicion. Limitations of our study: the sample size of our study was very small, short follow-up for 6 months, and it's a single institutional study. Thank you.